Shoulder dislocation. Shoulder joint. The shoulder joint is formed by the union of the humerus, the scapula, and the clavicle. It is also a ball and socket joint that is formed between the articulation of the rounded head of the humerus and cup-like structure which is the scapula. Muscle, tendon, ligament of the shoulder joint. The ring-like cartilage that is also known as the labium surround the Juliet fossa. This helps in the extent of the size of the socket while it maintains the flexibility. There is three main ligaments, the rotator cuff muscles and the tendon wrap around the head of the humerus to improve the stability of the shoulder joint. This is an example of a calf muscles. Four primary movements of the shoulder. The four primary movements of the shoulder are flexion, extension, adduction, and adduction. This is an example of a shoulder movement. What causes the shoulder dislocation? Shoulder dislocation occurs when something heavy falls on the arm. Most people often have shoulder dislocation mainly during contact sports such as rugby. In older people, this often happens to them because they fall onto a smooth surface such as a wet floor, which can happen that they will outstretch their hands. Three types of shoulder dislocation. Three types of shoulder dislocation are anterior, posterior, and interior. Anterior shoulder dislocation. Anterior shoulder dislocation are usually caused by a direct blow to or fall on an outstretched arm. This is an example of a anterior shoulder dislocation. Posterior shoulder dislocation. Posterior dislocation are occasionally due to the muscle contraction from an electric shock, and it may be caused by strengthened imbalance of the rotator cuff muscle. This is an example of a posterior shoulder dislocation. Interior shoulder dislocation. The arm appears to be permanently held upwards behind the head. It is caused by an hyperadduction of the arm that forces the humeral head against the acromion. This is an example of the interior shoulder dislocation. The symptoms of shoulder dislocation: several pains, numbness in the arm, swelling, inability to move the joint, and out of place of the joint. The recovery time. It takes about 12 to 6 weeks to recover the shoulder dislocation. It must be avoided heavy lifting and sports activities that involve in the movement of the shoulder. When the surgery necessary. The need for surgery depends on the functional demand of the patient and the presence or degree of the instability. Patients who have repeated the surgery for shoulder dislocation are usually called as the candidates for surgical repairs. Treatment for shoulder dislocation. Scapular manipulation. The patient must sit up or lie prone. The healthcare professional will help to rotate the shoulder blade, dislodging the humeral head, and also allow the spontaneous relocation of the shoulder. Thank you.